Hey everyone, welcome back to Mark Education Hub. In today's video, we're diving into the OET speaking test with a real-life scenario, the Accident and Emergency Department. You'll learn how to communicate effectively with patients in urgent situations, use the right medical phrases, and boost your confidence for the test. Let's get started. In this OET speaking role play, you are the attending nurse in the Accident and Emergency Department, assisting a 30-year-old patient with a dog bite on their leg. Your role is to find out what happened, gather details about the time, severity, and initial care of the wound, and check if the patient has used any painkillers or antiseptics. You'll then explain the treatment process, including cleaning the wound, a doctor's examination, necessary tests, blood test, possible X-ray, and prescribing antibiotics and pain relief. You should also recommend a tetanus booster and inform the patient about current animal bite care guidelines. No stitches initially to reduce infection risk. Finally, reassure the patient that the doctor will confirm the treatment plan and advise them to return for a follow-up. Stay clear, professional, and empathetic throughout the conversation. Start the conversation with a warm and professional greeting, introducing yourself as the attending nurse. Then gently establish the reason for the patient's visit by acknowledging their concern. Good morning, afternoon, I'm your name, the attending nurse. How can I assist you today? Once the patient confirms the dog bite, express understanding and encourage them to share more details. I understand you've come to the emergency department because of a dog bite. Could you tell me more about what happened? This approach helps create a calm and supportive environment, allowing the patient to feel comfortable while you gather important information for further assessment. To ensure proper care, start by explaining the step-by-step treatment process in a clear and reassuring manner. First, we'll clean the wound thoroughly to assess its severity. The doctor will then examine it and may order a blood test to check for any infection. If there's a possibility of deeper injury, an X-ray might be needed to assess bone or tendon damage. To prevent infection and manage pain, we may prescribe antibiotics and painkillers. Rest assured, we'll take all necessary steps to ensure proper healing. This explanation keeps the patient informed while maintaining a calm and professional tone. To ensure complete care, assess the patient's need for a tetanus booster and explain the best practices for treating animal bites. When was your last tetanus shot? If it's been more than 5 years, it's recommended to get a booster for added protection. Would you like me to arrange that for you? Then, clarify the treatment approach for animal bites. For bites like this, we usually avoid stitching the wound right away. Keeping it open allows for easier cleaning and lowers the risk of infection. This keeps the explanation simple, informative, and reassuring while guiding the patient through the necessary steps. Before wrapping up, reassure the patient by confirming the next steps and offering support. The doctor will examine your wound and confirm the best course of treatment. You'll also need to return for a follow-up in a few days so we can monitor the healing process. End with a warm and open-ended statement. Do you have any other concerns or questions about your treatment? We're here to help, so please don't hesitate to ask. This approach ensures the patient feels informed, cared for, and comfortable reaching out if needed. That's it for today's OET speaking practice. If you found this useful, don't forget to like, share, and subscribe.